Welcome to Philippa Squared, Parenting by Design. I'm Philippa Scott, and my co-host is the beautiful Pippa Cox. Hi, Pippa.
Hello, Philippa. How are you today?
Fabulous. So today we are talking about finding the right care provider in pregnancy, the one that aligns with you. So we're going to talk about the different options that are available out there, but we're also going to talk about how to determine what your needs are, how to know what's going to align with you or not, and then how do we make that work if we're in a rural or regional setting where we don't have a lot of options. So we are very blessed because Pippa has lots of experience in all sorts of different regions and countries where different options are available, or lack of options are available. And so we're going to talk all those things today. So, Pippa, where would you like to start?
Oh, this is such a huge topic, isn't it? So, I mean, aren't we lucky in Australia? I mean, I know there's a lot of discrepancy between the metropolitan areas in Australia and rural Australia and metropolitan Australia. But you also have to remember that we do have hospitals and we do have home birthing and we do have skilled people here, which is fantastic. I really don't know where to start.
Okay.
Where to start?
Well, let's start with what the different
Go for it.
options are, right? So the different options for pregnancy care include, so most women will find themselves pregnant and they will go along to their GP and their GP will confirm their pregnancy, and then they will ask, where do you want to go? Do you want to go private or public? And that's usually the only question that a woman is asked at her GP. Are you going private or public? And if you've got private health insurance, they will usually suggest that you head on over to your private hospital, whoever they have a relationship with maybe, or depending on, where you live and what you're asking for and who's available, you'll pick an obstetrician. That's exactly what happened to me in my first pregnancy. I had private health insurance, so I was bundled along to the private hospitals, and then I just had to choose which private hospital I was going to go to and which obstetrician I was going to use. And so that's one option. The other option most commonly used in Australia is the public hospital system, where you will either have and maybe an MGP program where you're getting a small group practice midwifery care, or you'll just be in the standard midwifery care and you'll see a doctor a couple of times through your pregnancy. I think the normal is maybe 3 times during your pregnancy you'll see an obstetrician or a registrar, and then you won't know who you're going to see during your birth. It could be any midwife and any obstetrician. Whereas when you go private, you generally won't see a midwife until you get to the birth, except she might run some childbirth education classes, and that doesn't mean she'll be there at the birth, but then you generally will have that obstetrician at your birth, unless of course it's on rostered days off, or is away, or she. So those are the 2 most commonly used services in Australia. However, there are more options available to you, one of which is shared care, and a lot of GPs like shared care because it keeps them in their care for longer, so they have more billable hours. So that's another option, is to see your GP, and then they often will refer you after 20 weeks to the public hospital system or to the obstetrician, although generally if it's an obstetrician they'll send you on earlier. Then an option used in Australia less commonly, I think it sits at around 3% or 4% at the moment, and that's having a privately practicing midwife. Now, there's a lot of stuff going on in the public system around that at the moment because, in the public sector, because of the insurance issues around privately practicing midwives and the fact that their indemnity is being taken away as of July next year, and they have to come up with a solution between now and then, although Home Birth Australia is pushing for an extension on that because there hasn't been enough consultation around all of that. But the way that works is that you would still go to your GP generally, and you would get a referral to a privately practicing midwife, and she would then do your care for your entire pregnancy and your whole birth, unless for some reason she was at another birth. You'd always have a second midwife who would come in to assist during the birth, and you would have met her before. And then sometimes there would be a backup midwife that might come in just in case, two births are happening at once or somebody's sick or so on. So that way, that in that model, you get to know exactly who your care provider is, and they're with you from then right through until 6 weeks after the baby is born. Other options include free birthing. Now, some people will free birth, and what that means is that there's no care provider at the birth. Some people will do that in what they call a wild pregnancy, which will mean that they won't have seen a care provider at all throughout the entire pregnancy, or they might have seen maybe somebody once for something, but generally speaking, a wild pregnancy is one without any prenatal care at all, and then they do the birth by themselves. You already know on this podcast, I had a free birth in Townsville because there was no privately practicing midwives available, but I had all of my care through a community midwife for 2 pregnancies. So I saw her for all of my antenatal care tests and anything else that I wanted done. So mine wasn't a wild pregnancy, it was just a free birth. And she came and did baby checks afterwards as well. So those are the most common, and I can't off the top of my head think of many others, unless you go to a group midwifery practice, which there's some of those that are situated where you'll have small groups. Or birth center. Oh my God, I literally got a birth center built in Townsville. Birth center is the other form of care. So they generally happen outside, like within a hospital scenario. So they would be attached to a public hospital, and you could choose to be part of a birth center where they're generally a low risk model of care, but they're usually centered around physiological birth. So women or families who want to attempt a natural birth, not at home, but within a hospital system, but in a specific model of care that usually has 2 or 3 midwives working in a practice together. And then one of those would be at your birth, and they provide all your antenatal and postnatal care as well. Now, am I missing any, Pippa?
No. And that birth centre is really closely linked with MGP programs. So it's all part of the public system.
Yeah, it is on the Sunshine Coast, but like in places like Townsville, where I was president of Friends of the Birth Centre, it wasn't linked with MGP. It was very separate.
It wasn't linked with the hospital.
It was linked with the hospital, but it wasn't part of MGP. Whereas here on the Sunshine Coast, the birth centre is another MGP program. So you've got, the Indigenous MGP, you've got the young mums, so there's a few and then you've got the birth centre, but it comes under MGP, whereas in Townsville, it's its own entity. And I think it's its own entity in Mackay as well. I'm not sure about other places around Australia.
But it's still part of the public system.
It's part of the public system, but so is core midwifery programs, and they're not associated with MGP particularly either. So, yeah.
Yeah.
There are models within the public hospital system, if that makes sense. Core, MGP, birth center, And there
So
might be,
basically it depends if you want the same person to be with you throughout your pregnancy, your birth and postpartum care, or if you don't really care.
yes. Yes. Now there is significant research that suggests that even if you have a high-risk pregnancy and you have an obstetrician, that the safest and best model of care for you is to actually still have a known midwife, so that you have that model where your midwife is still going to be part of your birth, even though you have an obstetrician who's part of the birth as well, and that improves outcomes.
Yeah, and
So,
why will that improve an outcome, Philippa?
well, having that, so it's important to understand the different aspects of, and I know you know this, which feels weird to explain it to you, but I know I'm explaining to
No,
our
you're
listeners.
explaining it to listeners. Yeah, I'm just facilitating.
So when you have a midwife, it's a different outlook. So midwives are trained in normal labor. They're trained in normal birth, and they're trained to spot when things are deterring from normal. And they are the specialists in natural physiological birth. Now, obstetricians are there for the outside of normal, the complications, the shit hitting the fan moments, right? But we have to remember that obstetricians are surgeons, and their specialty is in fixing problems, catastrophes, and coming in and dealing with that. Whereas midwives are there to facilitate the progression of normal labor. And for most women out there, normal labor is actually what's going to occur if they are allowed to just go into labor and have all of that happen for them. So having somebody there whose job it is to facilitate that can help that process continue to go along without the need for intervention. I have a doctor and a nurse in my family, and they've always said the more you look for problems, the more you'll find. So it's best not to over investigate sometimes, because you'll always find something if you dig deep enough, right?
Yeah, and that's really interesting because as a midwife versus obstetric care, I totally understand what you're talking about. And that was a really big part of my practice, was not investigating. I mean, investigating, of course, your routine test and everything like that. But when you really investigate to the umpth degree, like serial ultrasounds when they're really not needed, third trimester ultrasounds for a perceived big baby, that's a really big one, no pun intended. But you're finding things that you would not find if it was just normal care. So you increase the stress, you increase the likelihood of intervention, and not only that, it might not be true anyway.
Yes.
Because I'll tell you a little secret, Philippa, and I'm sure you know this secret, that if there was a problem, it comes out anyway.
Yes. Yes.
And I'm not talking about a baby coming out, because babies, that's just beautiful. But it does. And that's a really cool thing about midwifery and the experience that we have, exactly what you said about knowing the deviations from normal, is that when you gain a lot of experience as a midwife, you can pick up those deviations from normal really early and do something about them. And I'm not talking about going and seeing a doctor. I am talking about all those little midwifery and doula tricks that we have in our toolbox. Because we have big toolboxes, don't we? Massive toolboxes.
Yeah.
So we can actually do something about it. But we're diverging away from
we are.
topic.
So those are the options for care. So as a birthing woman, the thing for you to do is find a model of care that aligns with you. So I talk about this a lot in my birth and parenting coaching and education, and it's about what's your philosophy around birth? What do you believe and what do you want? So often women come into birth and they don't know what they want. They just know what they don't want. And so a big part of education, as we talked about in our birth plan one, is about understanding what you want from your labor and birth. And we start with what you don't want and work back from there. But if your care provider, so if I don't want an episiotomy and I choose a care provider who has a 60% episiotomy rate, am I choosing someone in alignment with me? No, I'm going to have to fight and be on guard during my birth to make sure that I don't get an episiotomy that I don't want. Now, if I choose somebody that has a 2% episiotomy rate, then they don't use episiotomies unless they absolutely have to. That's the kind of, and then I know that if they suggest an episiotomy to me, they're doing it because they really need to, and they wouldn't suggest it otherwise.
So what you're actually talking about, Philippa, is when you're deciding on what care provider you're going to employ for
Yep.
your care, to actually talk to those care providers and to find out what their statistics are. What are their induction rates? What's their cesarean section rates? If it's a home birth, what's their transfer to hospital?
Yeah.
What's their episiotomy rates? All those types of things. So these are questions that we, even through a public system, we have every right to talk to our care providers about them. Because if you're living in a big city and your nearest hospital has 12,000 births and 90% of those births are induced, and you're feeling that you've heard all these awful things about induction, and I don't know how I'm feeling about induction, and I don't think I really want to do it, even though this hospital is so close to you, guess what, Philippa? You do not have to go to that hospital.
Yeah.
You can find a hospital or a midwife or a doula that is in line with what your philosophy and your values are.
Yeah.
And in that way, throughout your pregnancy, you can feel safe.
Yeah.
You can feel like you're heard.
Totally. You know, as a VBAC mentor, so I've been, you know, as a VBAC mum myself, I've spent most of the last 20 years as a VBAC mentor as well, and working with women in terms of how to choose, because most of those women will have chosen a care provider that didn't align with them the first time, right? So then they have questions about, well, how do I pick the right person? How do I know? And sometimes by the time they get to me, they will have already picked a care provider and they're not sure because their spidey sense is going off. They're feeling like maybe there's some things there that aren't adding up. So think of it like interviewing anyone else. You don't interview an interior designer without seeing their work. You don't, because you want to get a feel for what it is they do. Now, I'm not asking you to see their episiotomy repairs. That's not really appropriate. But what we are saying is find out their philosophy. And one of the best ways to do that, like if you're a VBAC mum, right, or wanting to have a VBAC, going into if you've chosen a private obstetrician, go into your private obstetrician's office and say, okay, what I'd like to know from you is what your philosophy is on VBAC and how do you feel the best way to achieve that is. And so ask them for their plan. What would you do to help me make sure that I have a VBAC and that I am, that my risk factors are the lowest possible. And if they say continuous monitoring and a cannula and an induction at 39 weeks, you know you're in the wrong spot, because that's not actually evidence-based. But if that's what aligns with you and that's what you believe is going to be the best course of action, that's fine. But at least you know what they think is going to be the best source of care. Now, you can also then ask them about what do they feel about late pregnancy ultrasounds to check for the size of the baby. Oh, we do them as a routine. Why? Because, what if your baby's too big for your pelvis? And how would you determine that? And ask them, and do rapid fire questions, because they tend to just spit out whatever it is that they need to, that they think, right? So then you can take that information away and say, well, that doesn't align with me, and I'm not prepared to put myself in a position where I have a care provider who doesn't believe the same as me. I've had women who've changed care at 37 weeks pregnant because their care provider wasn't aligned, and because their care provider was saying things like, oh, you've got a big baby, we don't feel like VBAC's an option for you now. And they've strung them along all the way with the right words, and then at the end of it. So it is never too late. Well, if you've already had the baby, it's probably a bit too late. But up until then, it's not too late to change care providers if you feel that that's not aligned for you.
Totally, totally. And that's something that women really need to know. And for women in metropolitan areas who have the luxury of doing that, they have the right to absolutely do that. The women in rural areas in Australia, and particularly in Queensland, I don't know what it's like in New South Wales. I have a funny feeling it's very similar, but a lot of birthing centres in Queensland have closed down, which is a bone of contention. We're not going to go there and talk politics. However, a lot of women do have to go 2 or 3 hours to a local area to birth their babies, because it's mandated that people have to go to a city or to a town, to a hospital that has emergency obstetrics to have their babies now, which is a bit of a shame. And it's hard enough for Caucasian women to do that. It's really hard for Caucasian women to do that. But for Aboriginal women, for Indigenous women to go sometimes 1,000 kilometres, sometimes 3 or 4, 5,000 kilometres. I've had people, when I was working in Darwin, had to go to Adelaide to birth their babies. When I was working in Port Hedland, they had to go down to Perth to birth their baby for a very high risk birth. And so you're looking at women who come out in the bush, they live in the bush, and now you're putting them in by themselves. They're all by themselves in a big city. It's not very pleasant. So we understand that it's different in metropolitan Australia than it is for rural and remote Australia. We fully acknowledge that. And for women who have the luxury of being able to choose their care provider, I just hope we've provided some help along the way. We've talked about the different types of care. We've talked about the big one is if you want the continuity of care versus you just don't care. I'm fine as long as I have my baby and I don't care. That's okay. But for someone that wants to feel safe and nurtured throughout their pregnancy, continuity of care has unresounding evidence that it improves the outcomes for mothers and babies, not only physically, but also mentally as well, and emotionally as well for their mum.
Absolutely. And that comes back to the feeling of safety, right? So when we have that oxytocin going through our system to bring labor on and to make the contractions happen, if we get an adrenaline pump, and adrenaline comes when we feel unsafe, adrenaline pumps through the body and the oxytocin decreases or cuts off because oxytocin and adrenaline can't operate at the same time. So it's about feeling safe. if you don't feel safe, you can't birth effectively. And that's when complications happen. So in your instance, it's about sitting with your values, sitting with your philosophy around birth, and really understanding what that is, and knowing whether or not your feeling of safety comes from an absence of fear or because of fear. So again, we go back to that instinct versus intuition. Instinct is going to be us operating out of survival, whereas intuition is that deep knowing. So if we are, and a lot of people make decisions about their care providers based on instinct and fear, survival, but intuition is where we really need to be. And in order to sink into that intuitive space, we need to deal with any traumas that we've already had. And that can happen because of IVF, that can happen because of previous miscarriages, it can happen because of previous birth trauma. And previous birth trauma can send you a completely different way as well. So having had previous birth trauma, some women will do things like having a completely wild and free pregnancy and a free birth, but that's not always based on, I spoke to a woman this week who's in that situation. So, had birth trauma and then had a free birth and then had more children, and she's pregnant again, and she needs to make a decision about the kind of care she wants for this pregnancy. And for her, there's a lot to go through, and there's a lot to actually unpack before we can get her to a place where she's making a decision that in 10 years time she's going to feel good about. Because that's what this is about. It's about coming out the other side and going, I made the decision that was right for me, not one based on what I thought might be right for me, but what I know was right for me. And that can take a bit of unpacking to get to that space. Would you agree?
Yeah, absolutely. And a lot of women, I was just reminiscing, thinking about one of my past clients who had who decided to have shared care birth because she was one of these people that didn't really care about who was there at her birth. She just wanted to have a safe, happy birth and a healthy kid. That's all she wanted, was a healthy
Yep.
baby. And she ended up being induced at 39 weeks.
Mm-hmm.
Because that's what she wanted. She didn't want to go on to her in her pregnancy anymore, and she was induced, and she ended up having a really traumatic birth, and that was because she didn't take the time to fully evaluate her values and her beliefs and what she really wanted, what she really wanted, not just on the surface, but she did not dive deep down into it. And that's what she realized after the baby was born. She went, if only I knew, if only I knew. And all I could say was, you can lead a horse to water,
Yeah.
And
And I think that's the value of having a coach or somebody that you can work with that you trust, whether that's your doula or your midwife or a birth and pregnancy coach or whatever. Having somebody who knows what it is, who knows what you don't know, who knows that these things can happen, and then listening to them. Because
listening to them,
and that doesn't
listening
mean
to them.
doing what they say. That means hearing what they're saying, taking it on board, and understanding that they're giving you information for your best interest. If we tell a woman something, it's because we want them to really consider it. And I don't care what choices you make around your birth. Honestly, I don't. But if I'm working with you, I want you to hear what I have to say and make a decision with that as part of your consideration, not do what I tell you to do. That's not what it's about. And I'll never tell you what choices you should make, but I will say to you, this is a process for you to determine what you actually want. Do the work. Don't skimp on that. there is so much value in having somebody to have that feedback loop with, to be able to ask the questions of you that you might not even know that you need to ask. Ignorance is bliss, but it's not so blissful when you get to the end and you've had a crappy experience that impacts you for the rest of your life. So if we can have somebody in there who says to you, okay, and how do you feel about this? And how would you feel about that? And what does this mean to you? Having somebody who knows what questions to ask you makes a big difference, because you don't know what you don't know.
Massive, massive. But you've also have to be in a situation where you are willing to listen.
Mm-hmm.
That's another big key.
Yeah.
A huge key. Because a lot of people say that they want to listen, and yet they don't really take on the full account of it all.
Yeah. Yeah. Well,
Yeah.
I feel like we've come to the end of this conversation naturally. It's been wonderful to get on our soapboxes and share our thoughts with you. Again, do with it what you will, but by giving you this information, by sharing our experiences and of helping other women and our experiences for ourselves, we hope that you take something out of it that you can use. So please follow along with the podcast, interact with us on our Facebook or Instagram pages, reach out to Pippa or I if you've got questions that we can help you with in determining, your birthing options and what aligns with you. And we look forward to seeing you next week on at the very same Bat channel. Can I say that? Do people know what the Bat channel is still? Same bat time,
Maybe, I
same
don't
bat channel.
know.
I'm old. It's okay. All right. Thanks again, Pippa.
See you, Philippa. Bye.
Bye.